In 1963, a strange pattern began to emerge in American hospitals. Doctors were seeing more and more newborns with a devastating combination of conditions: profound deafness, cataracts blinding their eyes, and tiny malformed hearts. For years, the cause was a terrifying mystery. Then, a breakthrough. These children all had mothers who, during pregnancy, had experienced what was considered a harmless childhood rash, rubella, or German measles. This discovery revealed a chilling truth. A virus that barely touches a child can wage biological war on a developing fetus, rewriting its blueprint for life. Today, thanks to the MMR vaccine, these tragedies are rare in many countries. But in 2025, with vaccination rates slipping in some communities, rubella's shadow is returning. This is not just a story of a rash, it's the story of congenital rubella syndrome, CRS, one of medicine's most brutal examples of how a mild infection can cause catastrophic intergenerational damage. Welcome to Health Inside, Anatomy and Science. Today, we are traveling back to the 1960s rubella epidemic to understand a fundamental principle of virology and developmental biology. We will dissect exactly how the rubella virus crosses the placenta to attack a fetus, explore the specific birth defects of CRS, and make a powerful, evidence-based case for why the MMR vaccine is not just a personal choice, but a sacred responsibility to protect the unborn. Part 1. The Deceptive Disguise: Why Rubella is a Wolf in Sheep's Clothing. Rubella virus is a master of stealth. In children and adults, its symptoms are often so mild they go unnoticed. A low-grade fever, a fleeting pink rash that starts on the face and spreads downward, and swollen lymph nodes, especially the distinctive post-auricular nodes behind the ears. For the infected person, it's usually a trivial week of discomfort. But this mildness is the virus's ultimate weapon. It allows infected individuals, especially children, to move through their communities, schools, playgrounds, homes, unaware they are spreading a pathogen via respiratory droplets that is a potent teratogen, an agent that causes malformations in an embryo. The danger isn't to them, it's to the most vulnerable population among them, pregnant women and their developing babies. Part 2. The Placental Breach: How a Virus Becomes a Developmental Terrorist. The real horror begins when a pregnant person, often unaware they've been exposed, contracts rubella. The virus, traveling in her bloodstream, faces a critical barrier: the placenta. This organ is designed to be a selective filter, protecting the fetus. But during the first trimester, the period of most rapid and crucial organogenesis, formation of organs, the rubella virus can cross this barrier. Once in the fetal bloodstream, it doesn't just infect cells, it disrupts their very programming. It has a particular affinity for endothelial cells, lining blood vessels, and critical progenitor cells in developing organs. It doesn't necessarily kill these cells outright. Instead, it causes mitotic arrest. It stops them from dividing and proliferating normally. It also triggers apoptosis, programmed death, and creates chronic inflammation. Imagine building a complex machine, and at the most critical stage, someone randomly removes screws, bends vital parts, and pours glue into the mechanisms. That is rubella's effect on a fetus. Part 3. The Anatomy of Catastrophe: Decoding Congenital Rubella Syndrome, CRS. The specific birth defects of CRS are not random. They are a direct map of what was developing when the virus struck. The classic triad is known as the cardiac, cataract, deafness triad. Sensorineural deafness most common. The virus damages the cochlear hair cells in the inner ear or the auditory nerve itself, often causing profound bilateral hearing loss. This occurs in up to 80% of CRS cases. Ocular defects. Rubella can cause cataracts, clouding of the eye's lens, microphthalmia, abnormally small eyes, glaucoma, and retinopathy, damage to the light-sensitive retina. The virus interferes with the development of the optic vesicle. Congenital heart disease. The most common defect is patent ductus arteriosus, a failure of a fetal blood vessel near the heart to close after birth. It can also cause pulmonary artery stenosis and ventricular septal defects, or VSDs.
Neurological and developmental. CRS can lead to microcephaly, small head or brain, intellectual disabilities, motor delays, and behavioral issues due to direct brain inflammation and impaired neurogenesis. Systemic effects. The virus can also cause hepatosplenomegaly, enlarged liver and spleen, thrombocytopenic purpura, low platelets causing bleeding under the skin, and a blueberry muffin rash from extramedullary hematopoiesis. The risk is highest in the first 12 weeks of pregnancy, with up to 85% chance of major defects if infected. Infection later in pregnancy carries lower but still significant risks, particularly for deafness. Part 4. The Ghost of Epidemics Past, the 1964 to 1965 Rubella Pandemic. In the 1964 to 1965 global rubella pandemic in the United States resulted in an estimated 11,000 miscarriages and stillbirths, 20,000 infants born with CRS, over 2,100 neonatal deaths. Hospitals were filled with blind, deaf infants with failing hearts. The social and economic cost was incalculable. This catastrophe was the direct catalyst for the urgent development of the rubella vaccine by Maurice Hilleman and others. The vaccine was first licensed in 1969 and later combined with measles and mumps to form the MMR vaccine in 1971. Its impact was immediate and profound, reducing CRS cases in the U.S. to fewer than 10 per year by the 1990s. Part 5. The 2025 Reality, Herd Immunity, and the Return of a Preventable Threat. Rubella and CRS have been eliminated from the Americas since 2015, meaning there is no continuous year-round transmission. This is a monumental public health victory. But elimination is not eradication. The virus still circulates in other parts of the world, and it is only a plane ride away. The shield that protects us is herd immunity. Because rubella is primarily dangerous to the unborn, we vaccinate everyone to create a ring of protection around pregnant women. The MMR vaccine is 97% effective at preventing rubella with 2 doses. We need over 90 to 95% population immunity to maintain herd protection. In 2025, clusters of vaccine hesitancy and falling childhood immunization rates in some communities are creating pockets of susceptibility. These are the cracks through which rubella could return. Every unvaccinated individual is a potential link in a chain that could end with a baby born with CRS. The vaccine is not just for the person receiving it, it is a covenant with the next generation. Rubella teaches us a brutal lesson in biology. The severity of a disease cannot be judged by its symptoms in the healthy. A virus that is a footnote in a child's medical history can be a chapter of lifelong suffering for another. The story of rubella is a story of scientific triumph, a terrible syndrome rendered almost invisible by a simple shot. But it is also a cautionary tale. It reminds us that public health victories are fragile. They depend on our collective memory and our collective action. The MMR vaccine is a monument to our ability to protect the most vulnerable among us. Let's not tear it down through forgetfulness. If this deep dive into the history and horrifying biology of rubella and CRS moved you, please give this video a thumbs up. We must never forget why we vaccinate. Share this video. It's a powerful tool for science-based advocacy. Subscribe to Health Inside, Anatomy and Science, and hit the bell. We explore the stories where medicine, history, and human biology collide. Get vaccinated. Protect the vulnerable. Honor the past by safeguarding the future.